Healthcare experts say a troubling trend is developing amid the coronavirus pandemic, and it involves something as simple as a checkup. Practitioners say fewer folks are seeking routine preventative care, and it's already having a significant impact on the health of Hoosiers. Brock Turner has more.
For Indianapolis mother Damaris Contreras, the decision to take her daughter to the emergency room after a fall during cross-country practice earlier this month was beyond difficult. Her daughter Sierra is in 6th grade and came home complaining of pain and a tingling after falling during a run.
She said it felt like it burned from her toes to her knees, and so it was just something that I just could not ignore. But I knew that it was more than ice and Tylenol.
Contreras reached out to friends who were doctors and nurses in hopes of avoiding a trip to the emergency room. Each recommended she take Sierra to go get checked out, but Contreras, who had put off non-essential appointments and preventative care visits for herself and her family, was hesitant. This trip, though, was unavoidable.
It makes me nervous, and I don't like it, but we do it only when we have to, and an absolute have to.
She wasn't worried about the hospital staff or doctors. She just didn't trust the folks sitting in the waiting room with her.
But then the waiting room filled up with people that were not so much aware or as cautious as I would have liked for them to have been. And so I felt a little uncomfortable even then just sitting in the waiting room because I didn't know where these people were from and what kind of precautions and what they were walking in with.
And Contreras is not alone. Estimates show significantly fewer Hoosiers are seeking preventative care visits and undergoing elective procedures amid the coronavirus pandemic. That's leading practitioners to sound alarms. Data shows Indiana hospitals have seen emergency rooms and elective procedures plummet. While patient levels have returned to near normal levels in Indianapolis-based Community Health Network, there is a significant portion of the population that remains hesitant. That's according to the president of Community's Physician Network, Dr. John Kussner.
But we do know from our consumer research, there's about 20% of folks that just say they're not ready to come back this year and that they're pushing off elective things to next year because they want to wait and see.
For Dr. Camuel Wright, the medical director for CareSource Indiana, these trends are most concerning in two populations.
One is people of color, particularly African Americans. We already have a lower rate of seeking preventive health care, and we also have a higher rate of susceptibility to chronic diseases. In COVID times, this is magnified. So we are seeing less individuals from communities of color seeking important health care.
That's something Tracy Lewis has seen firsthand.
It's not that people don't know they need to go to the doctor. You'd be surprised how many people at a health fair or a church or wherever will mention some of their symptoms to somebody like me. And so it's not that there isn't the concern or desire, but often people will mention that they have a deductible or that they don't have health coverage, that they don't have a doctor who they have a good relationship with. Historically, a challenge has been the issues around trust.
Also at a higher risk are folks living in rural communities. Wright and others say a lack of broadband internet, longer trips to simply get to a doctor's office, and the age of populations there place them at higher risk for disease before the coronavirus. But COVID-19 only heightens the problem.
Individuals in these communities are also less likely to seek preventive health care. So I think that we as an organization and we as a community need to think through how we bust through barriers and make sure that individuals in these communities get the necessary health care.
For both groups, the issues are systemic and difficult to solve.
So these are not new issues. These are known issues to my organizations and other people in the public health space. It's just that these issues have been magnified by coronavirus.
Practitioners are worried about the long-term effects of this hesitancy.
And our docs are already seeing this. So if you ask our emergency room physicians, our cardiologists, our surgeons, our oncologists, people are presenting, unfortunately, with later stage diseases because they've been putting off that care. So we're already seeing it today.
Despite those warnings, folks like Contreras say they're going to hold off on making appointments that aren't completely necessary for now. She doesn't plan to have them until there is a vaccine or proven therapy. For Contreras, the worry is not even for herself. Like most mothers, she's more concerned about the health of her 2 children.
Maybe I should, but I don't, because moms tend to think of themselves last, and I guess that's where I am.
For Indiana Newsdesk, I'm Brock Turner.